My name is Dr. Buonassisi, and I'm a board-certified facial plastic surgeon with a practice in Vancouver, Canada. I've been specializing in cosmetic rhinoplasty for almost 20 years, and I'm here to answer your questions about this very interesting procedure. Happy patients are educated patients, and that's why every question is a good one.
So how is computer imaging different than you photoshopping your nose? The big difference is that I'm doing it. And when you're photoshopping your nose, you might have some ideas about what you think looks good if you were a painter. But when I'm doing the computer imaging, I'm making changes to the nose that are possible with surgery. And I think that's the big difference. There are things that you can do with a computer program that you just can't do with surgery. And I don't think there's a real point in me showing you something that I can't actually achieve with surgery. So this is why I think it's very important with your computer imaging that your surgeon does the computer imaging with you, explains what surgical maneuvers will result in the visual changes that they're describing, and gives you an honest opinion about the certainty that you're going to achieve those results. So that doesn't mean that you shouldn't Photoshop your nose. It's perfectly fine. It gives me lots of information about what you think is a good aesthetic result. I can tell you though that from years of doing this, that often patients will show me their computer imaged photos, and they often don't look particularly natural. They've done things that are outside of what's possible surgically. Sometimes they'll change one feature so much that it doesn't look like a natural nose anymore. And so although I'm happy to look at photos that people have imaged, or I'm even happy to look at photos of other people that they bring in and show me, but it's really just for me to get a sense for what their aesthetic goals are in general. I certainly don't work off of those photos, and I think that I encourage people to have a look at the computer image photos that we do in the office as the likely result of surgery.
Thanks for listening, and check back regularly for new questions and my honest answers about rhinoplasty.